The whole world currently is at standstill due to coronavirus spread. When there was an outbreak of coronavirus in Wuhan, that is in China, um, little did people know that this thing was going to be a big problem. And I realized, I remember that many people thought it was going to be a joke, but it is so difficult to understand why something like a small virus can take the whole world at a standstill. Even the biggest economies currently are struggling to contain the coronavirus. We do hope and trust that this virus is going to be contained, especially by virtue that we as Africans, or we on this continent of Africa, do not have the the best health infrastructure to contain that virus, if at all it is going to attack us in a similar magnitude it has done to those developed countries. I would also want to take this opportunity to add my voice to issues that the government has taken, the measures the government has taken to put in place to fight this virus called corona. Number one is the issue of the curfew and restricted movement in certain parts of the country. And I do want to applaud the government and by extension the Ministry of Health and all the other players that have taken their time to think through these measures, so that in one way or the other we help prevent the spread of that virus. I do want to urge my fellow Kenyans to take caution and to understand that this is not a time for us to joke around. This is not a time to play with the cat and mouse games with those authorities that are enforcing the law. It is time we need to pull together as Kenyans, be our brother's keeper, and ensure that we prevent the spread of this virus at whatever cost. The government has said that people should wear masks while in public. How I wish that we just follow that directive. However difficult it is for those who can't afford these masks, we hope that in the near future the government will be able to provide those masks for us, so that we can together help the government and other players towards preventing the spread of that coronavirus. The government has also stated clearly that people need to keep physical distance. This is a world known remedy that if people keep physical distance, then it reduces contact, it reduces people to people contact, and by so doing it prevents the spread of this virus. My fellow Kenyans, I would want to tell you that it saddens me, or it makes me sick when I see people hiding in bars at night. Some of them leaders of this country, people that are respected in society, trying to think that this issue of corona virus is a joke. We need to condemn and condemn these people in the strongest terms possible. And I just want to urge my fellow Kenyans that we need to take this issue of coronavirus very, very seriously. I will be taking time to respond to a few questions that people have sent on my YouTube in regard to the treatments, to the drugs that have been that are showing some level of efficacy, or sorry, level of activity against the coronavirus. And then also there are some people that have asked issues to do with the psychosocial effects of these issues to do with the quarantine and social distancing and things like those ones. I would take my time in a few minutes to explain to you the few advances that have been made in the field of pharmacotherapy in regard to development of a few vaccines that are still under clinical trial, and also a few drugs that are also are promising and are still under under research. And so there is good effort in that regard. And so I'll take a bit of time to respond to those questions when the right time comes, so that you can be informed. Otherwise, for now, I want to wish